You know how we have always talked about HIV prevention using condom, daily pills, and being careful. Now, what if I told you that there's a new medication right now that you can take to prevent HIV, just 2 injections a year? Sounds almost too good to be true, right? Well, let's talk about it. This medication is changing the conversation around HIV prevention in a big way. Instead of taking a pill every day, this one works as a long-acting injection. It stays in your body for months. But before you get too excited, let's break this down properly so that you understand what actually this drug does and what it doesn't do. Firstly, Lenacapavir is not a vaccine. Now, take note of that because this is very important. Don't mistake this just for a vaccine. Lenacapavir is not a vaccine. A vaccine trains your body to fight virus, but this drug works differently. It is what we call an antiviral medication, an antiviral drug. It blocks HIV from multiplying in the body. Right now, this drug is mainly approved for treating people who already have HIV, especially when other treatments are not working well. But here is where it gets interesting. Researchers are studying it for something we call prevention. Now, this is what we call PrEP. That's pre-exposure prophylaxis. So how does this drugs actually protect you from having HIV? Now, you need to understand that when lenacapavir is inside your body, that's inside your system, it targets a part of this HIV virus called the capsid. Think of the capsid as the share of the virus. Now, if this virus cannot function properly, it will multiply, right? And if it can't multiply, it can't establish infection, right? That is the science behind it. It works to prevent HIV by blocking a protective shell called the capsid, stopping it from entering the cell's nucleus, that's the human cell's nucleus, and preventing new viruses from forming. Now, this is how lenacapavir works in preventing HIV and also stopping it from multiplying. Let's address some big claims. Can 2 shots a year actually prevent HIV, like taking every shot every 6 months? Can it prevent HIV? This comes from clinical trials where people receive injection every 6 months, and the result was very promising in some studies. Protection was extremely high. But here's the honest truth. It's still being rolled out for prevention, not yet widely available, must be given by healthcare professionals. So yes, it's free, but just that, it's not something that you can casually walk in and get everywhere you go. This could be a game changer for people who struggle to take daily pills, people that are at risk of HIV exposure, people that want a more private and long-lasting options, not just something that you just go to the hospital every time to take your pills. No, just 2 injections a year, you're done. Imagine not remembering to take your daily pills every day. Some persons, they fall into this category. Even to take their malaria treatment, they can extend it for 1 month. Malaria treatment of 3 days. Sometimes they can forget to take their morning and they take evening. So if you fall into these categories, there is a solution for you. All you need to do is to walk into the clinic just 2 times a year and take your injection. So this drugs works both for HIV prevention and also for treatment. Very effective. Now, for those of you that lives in Nigeria, this drugs is now available. Lenacapavir is now available as of March 2026 right here in Nigeria, and it's currently free, but it's available only in 8 states: Kwara State, Kombi State, Ebonyi, Anambra, FCT, that's Abuja, Akwa Ibom, Cross River, and Benue State. Now listen up, this is where you can get this medication. It's not available everywhere. You can get it at designated government health facilities and pilot sites, primarily under the National Agency for the Control of AIDS, NACA. You can get these drugs there. Now, for those of you asking if this drug is free, this injection is provided free of charge as part of the National Pilot and Research Program, particularly targeting high-risk individuals, women, and young people. Now, if you learned something new from my video today, don't forget to give a thumbs up, like, subscribe, and share. Bye.